Hello everyone. Today we have with us Dr. Ganesh Kulkarni, who is a leading pediatrician, senior practitioner at Hajinagar. Welcome, Dr. Ganesh.
Thank you so much.
Thank you.
It's a pleasure and honor to be here on your platform.
Thank you for giving us the time. Today we shall be discussing on the very important matter of how and what we as pediatricians need to do once we have given an expired vaccine. So Dr. Ganesh, let's start the beginning. You have in error or not, inadvertently given a vaccine to a child, which is you realized immediately that it was an expired vaccine. So this happens in a very, very busy practice. How are you going to deal with this situation as a pediatrician?
Yeah, of course. Errors are part of life, that's what I would say, and humans err. That's something which happens. But how much grave that error is, a lot of things depend upon that. So this is a situation where in our day-to-day practice, when we are busy treating our patients, some inadvertent things happen, unknowingly happen. And that's where such a situation may come. And a lot of pediatricians have faced such a situation in the past, giving a vaccine inadvertently which is already expired. Now, this situation has two aspects, I would say. One is somewhere when you realize that you have given an expired vaccine and you are dealing with it, that's one situation. Now, the other situation is parents got to know when you stick up a label there, and the parents got to know that you have given them an expired vaccine, and then you are dealing with that situation. These are two different aspects of the same error. Now,
so let's start with the first part of it. So you have mentioned that the first part is where as pediatricians, how are we going to deal with it? So if you can briefly tell us what are you going to do? I will inform the parents. Yes, no. What is it that you will do as an immediate action?
So sure. So that means I have realized that I have given an expired vaccine. Parents did not even know about that. The situation is here. This has I have realized it. I have realized it. Now I have to assess the situation. Which vaccine I have given, how long it has been expired, why it was there in my cold chain first of all. So all these things I have to assess. What are the batch rate? I have to put it down everything because it comes under immunization error. So somewhere I have to put it through as an identifier as well. So I need to have everything taken up on the paper.
Yes. So this is what you're going to do to prevent such things in the future. So you're going to make sure that documentation happens and you're going to report it as an DEFI to the district immunization officer. Right. So that this does not happen in you. But now, how are you going to manage the situation that is
So this has happened now, and as I said, once I have documented everything, now the moral dilemma here is whether I have to tell it to the parents as well. And I have to tell it to the parents for a reason that I have to revaccinate. Now in expired vaccines, the situation is it is not about the toxicity. It is about the potency of the vaccine that you have administered to the child.
So what you mean to say that giving the expired vaccine is not going to cause any harm to the child? Is that
yes? That's probably I can reassure you and the parents as well. So I have a plan to be given to the parents. I want the 4A approach. The 4A approach is basically A is to accept that I have inadvertently committed this error. That's first. Second, A comes for apologize. It is always good to apologize when you create an error. That shows your magnanimity and your sincerity towards that error. Parents would definitely be on your side. So that's apologize. Third is to assure the parents now that nothing is going to happen wrong with your child. Now how do you do that? So there is quite some data that comes from the government body, the international bodies, CDC, WHO, and those national programs. There is something which is called as Vaccine Adverse Event Error Reporting, and that is VAERS, which is an US-based AFI reporting system. That has shown that more than 125 varicella vaccine, the influenza vaccines which were given after the expiry date, did not cause any kind of harm to the parents. So that's something which I can reassure and tell the parent that don't worry, I can take the responsibility that your child is not going to suffer because of this expired vaccine. But at the same time, vaccines are made to protect you for the future infections. Potency of this expired vaccine is at question. So that is the reason now I have to revaccinate your child, and that comes under the last A, that's called an action. So this action comes that I have to revaccinate this child. Now here there is again a situation where you need to know which vaccine we have given at the expired vaccine.
So yes, Dr. Ganesh, now if you realize this immediately, so you have given and the patient is still in your waiting area. So what are you going to do? Are you going to administer another dose immediately, or what are you going to do?
Sure. So as I said, which vaccine I have given. If I have given a vaccine, which is a field vaccine, an activated vaccine, I have all the chance to revaccinate that same child right now in my clinical setup at the same time. That's one thing. Or I have a liberty to give a killed or an activated vaccine. Henceforth, at any particular day, there's no gap of giving between the two dosages, because the dose that I had given in an advantage is called invalid dose. So I can repeat it. But the situation differs when if I had given a live vaccine to that child. Then I'm not able to, even if the child is there in my clinic right now, I may have to defer it for 28 days hereafter. I will take a gap of 4 weeks, call the parents again, do the same vaccination at no extra cost.
Right. So important is the revaccination is at no extra cost. But can you give me, I'm repeating my question, the live attenuated vaccine on the same day?
No, actually, there are again two theories to it. Initially, it was said that if on the same day you are able to give it, you can give it. But having said that, expiry date does not really give you the exact amount of live the organism that you have inoculated, the strength of those live, the concentration of those live organisms that you are given. So there is always a chance of multiplication happening in a much more potent way. So that's the reason why the board guidelines say that wait for 28 days and give it the same time.
So message is very clear. You will ask them to come back after 4 weeks in the case of the live attenuated vaccines like MMR, varicella, etc. But in any other killed or inactivated vaccines, you can give it any right. So you have explained what action you are going to take as a pediatrician. Now, what happens many times is that the parents get agitated,
Right.
Especially when they think that it's going to harm their child. And there are cases wherein the parents have gone out and filed an FIR also. So many times, I'm sure even you get queries to family against. What do you do in such a situation?
So that's where you have to the word E comes into the picture, is that explain, re-emphasize them, reassure them that it is going to happen to them. I know this is a situation where it's a very tricky situation, because whatever you are going to tell, parents are not going to accept it, because you are the one who have committed the error. That's the reason why the parents do not believe on it. Now here I think you have some reports, evidence-based reports that you can give it to them, show them that these are the reports came from the national bodies, international bodies. That's one thing. Second thing is you may direct them to the vaccine experts in your city or in the entire nation, who would also advise them that don't worry, nothing is going to happen. That can create a definite trust on them. But you can tell them that go to anybody those who wants, but he should be a scientific person who understands what vaccinology is, and they can take their opinion as well. That will in fact help them to satisfy that nothing is going to happen.
So you have talked about the documents and data which is available from the international bodies. Any Indian document which you can use to convince the parents that no harm is going to happen?
Absolutely. I mean, we have Indian Academy of Pediatrics, which has its own advisory board for immunization, that's called ACBIP. Now, this ACBIP publishes its white paper and its guideline books every often, and that's where we have had the last purple book that came in, which also reinforces the same data from the Western world, and they say that yes, it is a reassuring thing that these expired vaccines do not really cause any kind of damage to the child.
Right. So I think you have explained what actions need to be taken. I think the most important point that we need to highlight is that please make sure that you do not commit such immunization errors by ensuring that you have your stock checked, your logbooks up to date. And in a busy practice, what we say as the vaccinologist is that look at the vaccine vial, call out, read it out at least 3 times. So that way the chances of making these kind of errors will be minimized. Thank you so much, Dr. Ganesh. Any final word you would like to?
No, see, as I said, I started with the philosophy that humans make mistakes, but if you are very particular about certain things, you can minimize your errors. And that too, errors in a health sector or health zone sometimes may prove very fatal. And that's the reason we have to be more conscious, over conscious about it. That's the take home message. Be careful.
Thank you so much, Dr. Ganesh, for your time and for explaining on this very, very important topic of how to manage cases of where expired vaccines are. Thank you.